Now it's time for our sponsor-produced segment of the program. We're going to hear about a recovery community organization that's making a big difference in Greenville, South Carolina. I'd like to welcome on stage Rich Jones, Executive Director of Faces and Voices of Recovery Greenville, and Patty McCarthy Metcalf, Executive Director of Faces and Voices of Recovery. Patty, over to you.
Hi, good morning. First, I want to give a big shout out to all of the people in long-term recovery, the people in recovery that have come here today, and also all of you out there across the nation that have come through and represented the recovery community. We're here to talk about what is being done across the nation around recovery support services. And so I'm a woman in long-term recovery, which for me means I haven't used alcohol or drugs in over 28 years. And I say that because it's changed my life dramatically, and it's allowed me to be here today with all of you. And Rich Jones, coming from Favor Greenville in South Carolina, we're going to be talking about, what's happening in recovery community organizations around the country and why it's so important to focus on this topic and supporting and funding recovery support services. So, Rich, tell us a little bit about what's happening in Greenville, South Carolina.
So before I get started on talking about Favor Greenville, I wanted to kind of clarify a couple things because I think it's great to take an opportunity to get the word out to the public. Favor Greenville is one of multiple recovery community organizations around the nation. There's a series of us, a network of these organizations that provide different services in different communities. In addition to the independent recovery community organizations, there are also recovery support services in recovery housing, collegiate recovery, recovery high schools. The point that I'm making with this is you're going to hear about one organization, but there's an infrastructure out there, and we stand ready to unleash a recovery army on addiction. All we need is to be sufficiently funded. Faces and Voices of Recovery in Greenville, we basically focus on providing recovery support services to the upstate of South Carolina, serving about 5,000 people a year. When you look at community-based recovery support services, the interesting part of that process, we're able to go out and we're able to integrate with the community, bring services to folks in the community. Treatment is wonderful. Treatment is a necessary part of the equation, but treatment is not recovery. And I think that's something that gets really, really confusing for folks. So what we do is we go out of our way to connect with people. If you look at just a typical story, somebody, the media has told us and movies have told us, and unfortunately we've all fed into this at certain points in time, that what happens is you get rushed off to rehab and then you come back and live happily ever after. We know that that's not how this thing works. Recurrence is a very common part of the process. So what we want to do is we want to find ways to engage folks and support people through those stumbles and those falls that are inevitable in this process. We focus on youth. We have special programming for kids aged 13 to 19. We focus on providing them social activities. We have a specialized service for those folks called Assertive Community Engagement, where we will actually go to the home. We'll try to connect with them in other non-traditional venues. Again, we want to get away from this idea that you got to show up, you got to see us, you got to get into my office and sit across from me for an hour. We want to find ways to connect to these kids. We want to find ways to connect to everyone. Our services are delivered by certified recovery coaches, and it's called different things in different states. We call them recovery coaches. They undergo a 40-hour training. We consider it a professional service. We hold them to high standards. Our organization is accredited by the Council on the Accreditation of Peer Recovery Support Services. That's important to note. This isn't, we're just not running around kind of flying by the seat of our pants trying to get this thing done. It's an organized, strategic approach to trying to engage people in recovery. We supervise these folks weekly. We provide ongoing, continuing education as well. And really, we emphasize engaging the unwilling, the people who have been labeled unwilling. That's kind of our sweet spot. Family recovery is a big part of what we do as well. About 50% of our services are delivered directly to moms and dads, husbands and wives. Run a parent group on Monday nights that averages about 60 people. It's amazing. And what we have found is that if you engage the family in the recovery process, not only does it increase the likelihood of success, a lot of times it brings the person into the process. So really what we're looking for is any kind of touch points. One other thing I wanted to add, in addition to these particular services, we have special programming. We also just started our own emergency department response program where if somebody shows up on an overdose, that's been incredibly eye-opening. That process, we feel like we're going to be able to make a lot of progress in that area. And basically our idea is let's find a way to connect, no matter what it takes. Let's take responsibility for the relationship. In terms of staff, we have about 13 part-time staff. We have a lot of volunteers. The volunteer management part of this is an interesting process. It kind of ebbs and flows. Whether you're a volunteer or whether you're a professional recovery coach being paid by us, we have the same level of expectations. And again, we're focusing on engaging the disengaged.
So Rich's program, Favor Greenville, is just one of hundreds of recovery community organizations around the country. And at Faces and Voices, we connect them through a network called ARCO, the Association of Recovery Community Organizations. So what happens at Favor Greenville, Rich, is pretty similar to what's happening at these recovery organizations around the country. And so we're here to talk about some of the funding and the challenges. So can you tell us a little bit about how Favor Greenville is funded and how you approach sustaining the work that you're doing?
So we're funded 95% from private philanthropy, local foundations. There wasn't a dedicated funding stream in South Carolina. We are part of the STR grant, and so our emergency room project is funded by the State Drug and Alcohol Commission. We're very grateful for that. But the reality of the situation is that if it wasn't for the individuals and the visionary people in that community of Greenville, we wouldn't exist. And so we feel like that needs to change. We feel like that needs to be different across the nation. But for now, we're going to get it done however we need to get it done. So it's private philanthropy.
So the most important point that we're here today to talk about is that recovery support services are often overlooked in the funding streams on the federal and the state level. And so when large amounts of funding are made available through Congress and through state appropriations, we have a voice, we want to have a voice at that table. And so the recovery community is active. We have boots on the ground doing these services, people in recovery, paid volunteer folks who have something to give back. We are, like I said, boots on the ground at a time when it's all hands on deck. We have to support the people, we have to give back what we have been able to accomplish in recovery through these organized and accredited recovery support service programs. So Rich, what are your suggestions? I mean, let's first start talking about the block grant. The block grant, the Substance Abuse Prevention and Treatment block grant that goes to the states has stayed level funded or not funded, no funding increases in over 10 years or minimal increases. And so it hasn't kept up with the cost of health care inflation. The need for raising the block grant is now $542 million a year is what is needed to sustain and reach the level of need in the states. So what other ideas can we bring to be part of the solution here?
I think the greatest challenge from my perspective is to make sure that as this funding rolls out, that it's really earmarked for recovery support services. So a supplemental funding mechanism to the block grant. It's not about taking money away from anyone, but what will happen is if we just keep funneling money into the existing infrastructure, into the existing system, and we keep raising the bar there, that money will stay there. So we don't want to take anything away from that, but we need money that, and the legislation is going to have to dictate this. It's going to have to say this is going to recovery support services, independent recovery community organizations, legitimate recovery housing services, legitimate recovery high schools. If it doesn't get written in and it doesn't get earmarked, it'll get sucked up through the existing system. And that's not an indictment on anybody. That's just the way the world works. So we think that could be part of it. We think that as we really do a good job and we start to gather data, that commercial insurance should be at this table, that this should be something that people's health insurance cover. The deal is that recovery coaching and recovery support services, it's a real discipline. It's a highly effective discipline. This workforce is the most dynamic, enthusiastic, positive workforce that you will ever, and they're ready to go. There's an army of us out there. And so, my suggestion is to make sure that the legislation says recovery support services, not treatment, recovery support services.
Thanks, Rich. So there has never been a more urgent, appropriate, and opportune time to have this discussion with policymakers, to have this discussion with insurers, to have the voice of the recovery community at the table when we're discussing appropriations, because we have been doing this work on the ground and built this infrastructure around the country for over 15 years now. And it's a vital, critical part of the solution to help people maintain the gains that they make in treatment. We can help people maintain long-term recovery, find long-term recovery, and they're less likely to need higher levels of care if we can wrap around the recovery support services for the individuals, the families, and the children that are impacted by addiction. So please continue to have us at the table, listen to our voice and our solutions, and engage us in those conversations. So we want to thank the Hill and also Indivior for being a co-sponsor of this event with Faces and Voices of Recovery. Thank you.